St. Augustine has been so good to us, and we just love it here.
I am very thankful to have a hospital like Flagler in the community where I live.
They are doing the things they need to do to try to care for the citizens of St. Augustine and St. Johns County.
My name is Ferris George. I've been a cardiologist here at Flagler Hospital since 1992. I moved here right after I finished my residency. St. Augustine to me is still a small town. I'm very happy to be part of St. Augustine. Everybody knows everybody here. The friendliness of the small town, all that has been very positive. Times have changed. The community has grown substantially, and with that, the hospital. I've had the opportunity to experience Flagler's origin with the cath labs. I have seen it develop from a one cath lab hospital to where we're running 2 cath labs and now upgrading to 3 cath labs. I've seen it develop a successful open heart program. I've seen it grow into the community where I think we have significantly benefited the cardiovascular health of St. Augustine, and I'm very proud to be part of that team. The hospital has been very enthusiastic about the introduction of the technology and acceptance of different technology coming into the community. But overall, just the continuum of care, what used to be a stress test to now the next step in that diagnosis of coronary artery disease, and then the progression to actually treatment of the coronary disease here in St. Augustine, the ease and facilitation of those patients remaining in their community, staying here with their family and their friends as they go through the process and get healthy again. And then the exit from the hospital and the reinduction back in the community. That whole process has been very, very exciting.
They tell me, and I certainly agree, that I'm a 90-year-old miracle to have gotten this far. I'm Joann Weeks, and this is my husband, Claude, and we have been in St. Augustine for 55 years.
When we first came, we liked it so much, we made a decision that we'd never leave.
July 20th, 2016, I went out to bring in the newspapers. On the way back to the house, I fell hard on my right side. Rescue came and I got to Flagler Hospital, and everybody there was so helpful. It was really just like coming home in a way. My hip was broken in 4 different places, but by the doctor's magic, he fixed it. I was there for several days. Everything was fine. I was feeling pretty good. And then the nurses came in one day and said, well, we have a little problem. You have AFib and we can't regulate your heart. They said, we're gonna have to put in a pacemaker. So the problem was, with a normal pacemaker, you can't put any weight on your left arm for several weeks. But I needed rehab, so they put in a special pacemaker, and I came home and had therapy here at home. I'd like to thank Flagler Hospital, all the doctors, the nurses, the therapists, everybody that has helped me get to this point.
My name is Derek Murky. I'm a cardiothoracic surgeon at Flagler Hospital. I've been here since 2003 when we opened the open heart surgery program. I've known Flagler Hospital for a long time. It has a closeness to it and a support system which is very different from other hospitals. I feel a sense of support from the physicians as well as the members of our team. In 2001, Dr. George asked me if I'd be interested in doing some of his hearts down here, and the process of obtaining a certificate of need was initiated. Eventually, in August of 2003, we opened our doors to do our first heart. The unique aspects of Flagler Hospital is it's a small town, and it's a small town with an extremely busy hospital. I'm impressed by the volume of surgery which we do for a small town. We've helped a lot of people in the community not have to travel to have their surgery. A very important aspect of our success here at Flagler Hospital is the concept of having a team. And the team is made up of many people, the people who wash the floors, stock the shelves, the nurses, the mid-level providers, the other physicians, the lab technicians, the administration and their support. The community is a part of our team. The community has supported our project. Our first heart-lung machines were donated. The team concept is one which has allowed us to be successful. No one person can be successful without that teamwork. And if one team member falls down, other people can help out. And that's a very important aspect of getting a program like this off the ground.
My name is Dan Alexander. I've lived in St. Augustine my entire life. And I just think it's an absolutely great area to raise a family. I'm so truly blessed. I've been married to my wife, Deborah, for 31 years, and we have 3 children. I've always felt like it's very important to be active and involved in the community. Past chairman of the Chamber of Commerce, past president of the St. Augustine Rotary Club. I've tried to pay back what I feel St. Augustine has done for me. Heart disease runs in my family. At age 45, my father, Jimmy Alexander, passed away from a heart attack, and this was in 1966. And there wasn't a whole lot they could do for you when you were having a heart attack back at that age. So I kind of vowed to myself that, I'm kind of keep an eye on my health, which I did. About age 45, and you start thinking about, well, age 45 was at the time when my father had passed away. I'm a jogger and I like to exercise, and I started experiencing discomfort. I knew something wasn't right, so I called my doctor up, and he says, yes, come on in. And they came back and said, you have some blockage and are going to need a stent operation. So we went in for the stent procedure. He says, if I had a bucket of stents in all day, I couldn't take care of everything you've got going on in here. He goes, you're going to need a quadruple bypass. The emotions at that point in time were more thinking about my family. I wanted just to make sure that I took care of them. My doctors said they can do it at 6 o'clock in the morning. And I thought, well, no time like the present. Let's go ahead and take care of this and let's move ahead. Procedure was done on a Tuesday. I was discharged on a Saturday. Within about a matter of 3.5 months, I'd already run my first 5K race. I feel very, very good. It's been almost 5 years. I knew the doctors' reputations at Flagler Hospital, and I wasn't afraid to put my life in their hands. Flagler Hospital did a fantastic job for me.
I have worked in a number of facilities, and I think Flagler offers several unique experiences. On a patient level, I think patients feel true warmth from the staff members that are in the hospital. They constantly compliment the facility in terms of the care that they receive. My name is Sanghvi. I'm a cardiac electrophysiologist. I relocated from New York City, where I was in practice for 5 years before coming here. I think it's a beautiful area. We have 2 young children. We live right here in St. Johns County. We love the area, we love the town. The institutions here are great and the patients are wonderful. Here at Flagler Hospital, the footprint is one that is comforting to a patient, not so large that a patient feels lost in the facility. There's not enough that I can say about the fact that you're looking at sunshine in the intercoastal in the morning, and I think that really helps the spirits of our patients. When we think about cardiovascular care, we often think about 3 pillars of care. There's structural care of the heart, there's the coronary care of the heart, and then there's the rhythm aspect of the heart. We've been able to treat slow rhythms with pacemakers, some fast rhythms with implantable defibrillators, but many rhythms are not treated with either devices, but rather with a technique called an ablation. To date, many of my patients who require rhythm management have to go up to Jacksonville to get the care that they need. I'm super excited that we're going to be able to provide those services here at Flagler Hospital. It completes the third pillar of cardiovascular care.
My name is Searcy. I'm a veterinarian. I do a dog and cat practice here in St. Augustine. I started coming down here in high school surfing because the waves were better here. At that time, St. Augustine was a very small city, but I fell in love back then in high school. I decided that this was really the place I wanted to spend the rest of my life. I came here in 1977, right out of Auburn University Veterinary School, and married a girl who was born and raised here, Debbie Alexander. We have raised 3 children. My wife and I lost our son 8 years ago, and the outpouring of the community was the most heartwarming thing that I've ever experienced in my whole life. I realized how many people really cared about me. I still enjoy surfing, and I play music. I play the 5-string banjo and the dobro in a local band called the Driftwoods. Going to the gym to stay in shape to surf is how I got the idea that I might have a problem. I noticed that in spite of how hard I was working to try to get in shape, my stamina seemed to be getting worse rather than better. I'm an animal doctor, and I realized that exercise intolerance could be a symptom of a heart problem. I mentioned that to my bandmate, Gabe Valla, who is a critical care nurse at Flagler Hospital. He said, well, you should go to the cardiologist and tell him you want a stress test, which turned out to be some very good advice. I made an appointment, and when it was done, he said, your stress test is positive. You need to go and get a catheterization. I went in and had the catheterization done, and it revealed an 80% blockage. The doctor recommended that I get a double bypass. So January the 4th, I had a double bypass done. I'm a surgeon myself, and I know how well you recover from surgery, how well you heal has a lot to do with surgical technique. And I was very impressed with how well I did after having my chest opened up. I started back playing music again 2 months after the procedure, and I've been doing great. I'm so thankful that it's all behind me. Again, that I found out that I had a problem without having a heart attack. I know that my clients have faith in me to do the best with their pets. And I have to say, I got the same feeling at Flagler Hospital. I'm so thankful that I have quality health care right next door.
I'm extremely proud to be part of the cardiovascular team at Flagler Hospital. We are excited about our new Heart and Rhythm Center opening next year, and about the future expansion plans of our program. As a nonprofit hospital, our donors play an important role in our ability to deliver the highest quality care to this very special community. Thank you for your commitment to Flagler Hospital and to ensuring that your friends, neighbors, and loved ones have access to world-class care right here close to home.